Hi, my name is Dhia Khadeeja Binti from Group C1. I will present on the drug-food interaction between calcium supplements and iron-rich foods. Drug-food interactions occur when the effect of a medication are altered by the concurrent intake of certain foods or beverages. These interactions can modify the drug's absorption, distribution, metabolism, or excretion, potentially delaying, decreasing, or enhancing its therapeutic action or causing adverse effects. Understanding this interaction is critical in pharmacotherapy to optimize drug efficacy and safety, especially for patients on long-term or complex medication regimens. Food can affect each stage of a drug's pharmacokinetics. First, absorption. Food may delay gastric emptying and alter gut pH, affecting drug dissolution and absorption. Fatty meals can enhance absorption of lipophilic drugs, while some food may bind drugs and reduce uptake. Second, distribution. Post-meal increase in blood flow can slightly influence drug distribution, though effects are generally minimal. Third, metabolism. Certain foods like grapefruit juice inhibit enzymes like CYP3A4, reducing first-pass metabolism and increasing drug levels, potentially causing toxicity. Lastly, excretion. Food's impact on elimination is usually minor but can affect liver or kidney function indirectly. Understanding this interaction helps optimize drug efficacy and safety. Calcium supplements provide calcium to help build and maintain strong bones, regulate muscle contraction, including the heartbeat, and support nerve function. Common forms include calcium carbonate, cheapest contain about 40% elemental calcium, and calcium citrate. Some supplements also include vitamin D or magnesium to aid absorption. Side effects can include gas, constipation, and bloating, with calcium carbonate being more constipating. Iron-rich foods include both animal and plant source. Animal source have iron such as red meat, liver, seafoods like oysters, sardines, tuna, and eggs provide iron that is well absorbed by the body. Plant source non-have iron include leafy greens, beans, lentils, dried fruits, nuts, and fortified cereals. Calcium inhibits the absorption of both heme iron from animal source and non-heme iron from plant source in the intestine. This happens because calcium competes with iron for absorption pathways in the gut, possibly through shared transporter or by altering intestinal condition. As a result, when calcium supplements and iron-rich foods are consumed at the same time, calcium reduces the amount of iron absorbed into the bloodstream. This interaction primarily affects the absorption pace of pharmacokinetics, potentially lowering iron bioavailability. Absorption. Calcium inhibits iron absorption in the intestine by interfering with the divalent metal transporter 1 on enterocyte and by reducing the basolateral iron exporter ferroportin and heparin. This decreases iron uptake into intestinal cells and it is effluxed into the bloodstream, leading to iron retention within the cells. Distribution. Calcium does not directly affect iron distribution, but by limiting absorption, it can reduce overall systemic iron availability. Metabolism. Calcium does not interfere with iron metabolism, though reduced absorption could indirectly impact iron-dependent process. Excretion. Iron elimination is minimal. The body regulates iron balance primarily through absorption. Calcium's effect on absorption can thus influence overall iron status. Clinically, this interaction may increase the risk of iron deficiency anemia, particularly in populations with high iron needs or pre-existing anemia such as menstruating women, pregnant women, infants, and vegetarians. Short-term studies demonstrate a significant decrease in iron absorption when calcium and iron are co-administered. However, long-term studies indicate that healthy individuals often adapt and overall iron status remains stable despite calcium supplementation. Nonetheless, in at-risk groups, concurrent intake without appropriate timing may contribute to iron deficiency symptoms such as fatigue, weakness, and impaired immune function, which can indirectly affect bone health. Such iron is involved in collagen synthesis and vitamin D metabolism relevant to bone maintenance. Timing of intake. Take iron supplement or consume iron-rich foods on an empty stomach, ideally in the morning or between meals, about 30 minutes to 1 hour before eating. Vitamin C-rich foods like orange can help iron absorption. Take calcium supplements with meals later in the day or at a different time than iron, keeping at least a 2-hour gap to avoid interaction. This separation ensures better absorption of both minerals and improves their effectiveness. Dietary recommendation. Iron-rich foods include red meat, poultry, fish, lentils, beans, and dark leafy greens. Calcium-rich food include dairy products like milk, yogurt, cheese, fortified juice, tofu, broccoli, and kale. Avoid taking calcium supplement with iron-rich meals. Precaution: pregnant women and young children especially need adequate calcium and iron for bone development and blood health. Proper timing of supplement is crucial for them. If you are taking other medication, inform your healthcare provider as calcium and iron can interact with some drugs. For monitoring, if you experience any side effects like stomach upset or constipation, talk to your healthcare provider. Regular blood tests may be needed to monitor your iron and calcium levels, especially if you are pregnant or have a medical condition. What to avoid? Avoid taking calcium and iron supplement together or within a short time frame. Patients can consider liquid iron supplements or iron formulation with absorption enhancers and calcium citrate as an alternative calcium supplement to reduce the interaction risk. Intravenous iron is another alternative for certain cases. Always consult a healthcare provider to choose the best option tailored to your health status and medication regimen. That is all from me. Thank you for listening.